Thank you, Mrs. K, for allowing me to conduct the parent interview. If you could please provide as much information as you can, as your input and information regarding your child are greatly appreciated. So first of all, what is the primary language spoken at home?
English and Chinese.
Chinese. Okay, okay. And then if English is not your child's first language, what age do they learn English?
My son speaks only English. He doesn't really speak Chinese.
Okay. And then what language does? Okay, so you said English. Was your child adopted?
No.
Okay. How far along were you when you had your child?
He was full term, around 9 months.
Okay. Did you receive prenatal care, and in what month?
Yes, I did receive prenatal care at starting at about second month when I found out I was pregnant.
Okay. Were there any complications during pregnancy?
No, not really.
Okay. And then what about during or after delivery?
No.
Okay. Did the child eat well at home, or was there any problems during the feeding?
No, he was breastfed. Breastfed.
Breastfed. Okay. And then do you remember their birth weight?
He was around 9.5 pounds.
9.5 pounds. Okay. Um, so if you can give me the time frame of when your child received their the developmental milestones, I'll say each one. So what about sitting alone, so like by themselves?
Around 6 months.
6 months. Okay. What about crawling?
Around 3 months.
3 months. Okay. What about walking?
At one year.
1 year. Okay. Um, what about like babbling, like saying blah 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 blah, blah like baby babble stuff?
Babbling.
Yes.
At around maybe 6 months.
Okay. And then how about like their first words, like they say like mama or papa, things like
At
that.
around 9 months.
9 months. Okay. What about their first sentences, like full sentences?
Full
you'd say?
sentences at around 1 year.
1 year. Okay. And then how about when they were potty trained?
At 2 years old.
2 years old. Okay. Did your child experience any frequent like ear infections, like where their like ear were hurting or they had pus coming out?
No, but he did have at 2. He had a high fever. I took him to the doctor, and that's when the doctor said he had a severe cough, and they diagnosed him with asthma.
Mm-hmm. Okay. Um, anything? So no head injuries or um, hearing problems?
No.
Okay. Was your child ever hospitalized at all?
No.
No? Okay. How about any health problems or clinical diagnoses, or any mental health issues like ADHD?
No.
No? Okay. Does your child take any medications?
No, only the inhaler is needed.
Okay, inhaler. And then, are there any recent changes to your family structure, so, like divorce or a death in the family?
No.
No. Okay. What are your child's eating habits like? So, are they a picky eater? Do they like to eat lots of vegetables?
He's a picky eater. He likes to eat like junk food, nothing healthy.
Okay. Okay. Um, can you briefly describe your child's present difficulties at home?
He doesn't listen, and he doesn't like to do homework.
Okay, and then does he having any difficulties at school?
Yes, he does not like school because he said it's too hard for him.
Okay. Um, let's see. Has your child ever received any mental health treatment in the past? And then have they had to repeat any grades?
No.
Okay. Has your child been assessed for special education?
Yes.
Okay. In what grade?
In third grade, he was having trouble with school, and then in fourth grade, he was tested for special education, and he qualified for RSP.
Okay. Um, what do you think your child's strengths are in school?
Uh, he likes PE, he likes computer, and he likes lunchtime.
Okay. What about their weaknesses?
I would say weakness would be his reading, writing, spelling, and mainly reading.
Okay. And then what, in your opinion, do you think are the cause of these weaknesses?
I think a lot of it is the attention span. He doesn't want to spend the time doing the work, and he just rushed through everything, and he just wants to be done. But if I sit with him, he's able to read to me and finish his homework.
Okay. And then, does your family have any history of learning problems?
No.
No? Okay. And you said he has problems completing his homework. But does anyone help him complete his homework at home?
I help him. I usually have him sit next to me while I'm cooking, and then I would monitor him. It takes him a long time to do his homework.
Okay. And if you have any other children, how well do they do in school?
I have an older son who is 17, and he's doing well at high school.
Okay. So how many times do you think your child has been absent from school this year?
Maybe 20 days.
20 days? Okay. And so I'm going to ask you a few subjects in school, and I'll ask you to say yes or no if they have difficulty in it. So reading?
Yes.
Okay. Writing?
Yes.
Spelling?
Yes.
Math?
Not really. He's pretty good in math.
Okay. What about participation in class?
He doesn't like to talk, so I would say he has a problem with it. Yes.
Okay. What about paying attention during class?
Yes.
What about concentrating on work during class?
Definitely a problem.
Okay. What about behavior in class?
I would say yes for behavior too, because he doesn't want to do the work.
Okay. How about their handwriting? Is his handwriting messy or is it?
His handwriting's good.
Okay, that's good. What about remembering things? So what, like remembering to do homework and remembering things in class?
He has a hard time remembering that he has homework.
Okay, sounds good. Does he have problems getting along with his teacher?
He likes his teacher.
Okay. What about with other students? Does he have any issues with other students?
Yes, I would say yes because he thinks they talk too much.
Okay. Let's see. What do you think your child's favorite activities are at home?
He likes to use the computer. He likes to watch TV.
And what pleases you most about your child?
He's very kind and he's very helpful.
Okay. Does he do any chores around the house?
Yes, he helps with the dishes and he helps with the cleaning.
Okay. What time does your child usually go to bed?
Around 10 p.m.
Yeah, and then he gets up in the morning at what time?
7 a.m.
7 a.m. Okay. Does your child have any problems sleeping, like getting up at night?
No.
No. Okay. And then is your child left or right-handed?
Right-handed.
Right-handed. Okay. And does he wear glasses?
No.
Okay. And then we talked about hearing. So, what do you enjoy doing with your child at home?
We like to go hiking or walking around the neighborhood. Sometimes we walk our dogs.
Okay. And then, is there any other information you think will help us with the child?
I would like to get some help with him doing his homework
Oh,
and how I could help him with it.
okay. I think that's it. So, I'll also have you fill out the questionnaire after this. Is that okay?
Okay.
All right.